Morning दोस्तों, my name is Kamal Yadav. Today we'll discuss about the Neoplasm ICD guidelines. So let's start this topic. Chapter 2 Neoplasm. ICD code started from C00 to D49. Objective Neoplasm ICD-10 guidelines for coding Neoplasm. Introduction of Neoplasm. What is the Neoplasm? So question is coming here. So let's understood what is the neoplasm. Neoplasm are abnormal growth of tissue in a part of the body. Types of the neoplasm: malignant, generally spreads to other organs, cancerous. Second is a benign, mass of cell tumor that lack the ability to invade neighboring tissues or metastasize non-cancerous. Third is the carcinoma, CA in situ, spreads within the organ but does not move to out of the organ. So there are major types of the neoplasma is the three. Type of the malignant neoplasma. Let's discuss the type of malignant neoplasma. First is a primary site of the origin of the malignant neoplasma. So where the location, where the site, the first or like primary malignant is growing, that is called as a primary neoplasma. So here organ from where the neoplasma originated. Secondary or metastatic organs to the where the neoplasma had spared. Notes there are no tertiary or like a third neoplasma. So primary or secondary, two are only. Table of neoplasma. Neoplasma table will discuss here. First neoplasma malignancy. Malignancy is a primary and secondary. Neoplasma car in situ, CA in situ, encapsulated or pre-malignant. Benign neoplasma, non-malignant, uncertain behavior or unspecified. So these all are like types of the neoplasma. Uncertain behavior like inconclusive or unspecified, not specified as a cancer or tumors. So you can see there malignancy primary where it's originated or secondary where it is spared. So these are a table helping to understand what is a malignancy and how we can code into the neoplasma. So ICD-10 guidelines for neoplasma. Always check the type of neoplasma before assigning the codes malignant, benign, etc. So we need to check that is it malignant or benign. Overlapping site codes should be end with 8. Example C17.8. These are the primary malignant sites next to each other within the same organ. If the affected sites are not adjacent, give codes for each site separately. Malignant neoplasma of the ectopic tissues to be coded to site of origin. Example: ectopic pancreatic malignant neoplasma involving the stomach are coded to pancreas unspecified. ICD code is C25.9. For the tumorous carcinoids, adenomas, etc., the first look for the word in the alphabetic index, then go to the neoplasma table if indicated, and then to the tabular list. So in this way we will check the like how to find the codes, ICD code. For example, if the documentation includes the adenoma, refer to them to the alphabetic index to review the entries under these terms and instrumental notes to see also. Neoplasm by site benign. The table previous the proper codes based on the type of neoplasm and sites. It's important to select a proper column in the table that corresponds to the type of neoplasma. Table list should be then referred to the verify that correct code has been selected from the table and the more specific site code does not exist. Sequencing's ICD guidelines for neoplasma. Sequencing is always based on the reason for encounter. If the patient has primary and secondary neoplasma, the sequencing will be based on which neoplasma the treatment was directed by provider or physicians. Example, find the diagnosis for the 61-year-old female patient, a small cell carcinoma of the right lower lobes of the lungs. Answer is C 34.31. Second example, anemia due to malignancy as reason of encounter. A specific neoplasma ICD code series like C and D series code we need to code ICD. Anemia due to neoplasma D63.0. This is the only case where reason for the encounter is not sequenced first. So this is the exception of the anemia when we are coding neoplasma is the primary. Example, patient admitted for anemia finally confirmed that anemia is due to terminal carcinoma of the central portion of the right breast and treated for the same. ICD code C50.111, D63.0. So this is example we need to learn. ICD guideline for the neoplasma. Second point is there, anemia due to chemotherapy, immunotherapy and radiation therapy as reason of encounter. For chemotherapy and immunotherapy, anemia sequencing is here. First anemia, second neoplasma C or D series, third is the adverse effect of the anti-neoplastic and immunosuppressive drug, that is series is T45.1X5A series, right? For radiation therapy, the second guidelines for the radiation therapy, first is the anemia, second is the neoplasma, third is the radiotherapy causing abnormal reaction, that is the Y84-2 series is there. So we need to code this way. Sequencing, malignant management of dehydration due to malignancy. Dehydration is the primary diagnosis and neoplasma is a secondary diagnosis. Treatment of the complication resulting from the surgical procedure, first complication, second neoplasma, D or C series. Admission encounter for the pain control or management. Neoplasma related pain G89.3 series will be code primary. Neoplasma code will be code as a secondary. Malignant neoplasma in a pregnant. So first we'll code O9A series, that is complicated with a pregnancy. Primarily malignancy previous excised Z85 for the history of neoplasma can be only when the no further treatment is directed to that site that has been excised or eradicated. History codes can be used along with the code of the secondary neoplasma if primary is eradicated or removed. If the treatment is still on the excised neoplasma, it code as a active neoplasma. Okay. In a remission code C90, the meaning of the remission is curing or healing codes of the leukemia, myeloma, etc. have term, right? Remission in the code description which is required to be given by the physician. If disease has been cured completely, Z series code for the history should be used like Z85.6 series. There are also codes in relapse, which means it was cured and has reoccurred. So there is option relapse. Disseminated malignant neoplasma unspecified C80.0 can be used when the patient has advanced metastatic disease and no primary or secondary site are specified in medical record. Malignant neoplasma without the specification of the site, C80.1 diagnosis just the malignant neoplasma. The code should be sourced as the neoplasma malignant or primary. So in this way we can find the code and we need to code. Thank you for watching ICD-10 guideline for neoplasma. Hope you understood this video. My name is Kamal. You are watching my channel Kamal Yadav. You are learning coding with Kamal. Thank you so much.